safe streets, vibrant neighborhoods, successful business and commerce. These are things that make a healthy community. We are a diverse community, rural, suburban, urban, a multitude of languages and ethnicities, ages and experiences. We are a collaborative community. Public-private partnerships make us a model community that others want to follow. It is what makes us unique. It is what makes us strong. The employees of Kent County reflect our diversity and seek to serve our communities.
People in this county, in this area, we wrap our arms around each other. We come together to collaborate, to solve problems. We're all working for the good of the whole. And I think that's wonderful. And you can see it. You can see it as you drive around Kent County.
Our impact starts the day a baby is born and a birth certificate is issued, to protecting children from deadly diseases through vaccination, to the public safety and justice provided by law enforcement and the courts, to offering veterans services and caring for the elderly. Every day we work to keep our communities robust.
I think if you are somebody who's interested in serving your community, in building a strong knowledge base and a good group of people to work with, then the county is one of your best employment opportunities out there. It's been completely rewarding in every way I could possibly explain for 26 years, and I feel like I grow every single day still today.
Leading these dedicated employees, our 19-member Board of Commissioners and our County Administrator Controller, along with our elected officials and appointed department directors, placing emphasis on civic involvement, quality housing, vibrant neighborhoods, and strong, solid infrastructure to allow businesses to thrive. Professional, dedicated, collaborative, and innovative.
Behind the scenes, collaboration between foundations, charitable organizations, nonprofits, for-profit businesses, public sector demonstrated through the county, the city of Grand Rapids, the townships, all the cities and the villages in our area. If we don't come together, then we will not have the strength that we have today, and I only hope to build upon that.
Our aim is to make our communities the best they can be. We are involved in exciting development projects, sustainable recycling programs, and creative progressive prevention programming. We partner with elected officials, impacting policy ideas that become great achievements. We seek opportunities to reach out into the community and offer our services to help our residents make Kent County thrive.
Our relationship is solid, both from a staff standpoint at the county level as well as the Board of Commissioners. And they understand what we do and the benefits that we can do for the community, and vice versa. We couldn't do what we do without the help of Kent County.
While most of us are busy running our lives, Kent County's elected officials, administrator controller, and over 1,600 employees are serving the communities where we live our lives, so we can all have a place we are proud to call home. Kent County, its life well run.
Good morning. Welcome after Labor Day, and it is my pleasure to open up the Finance and Physical Resources Committee meeting. It is Tuesday, September 4th at 8:30 a.m. A warm welcome to fellow commissioners, guests we have in the audience, and fellow staff members. It's great that you take the time out of your day to come, and just let you know that we really appreciate you being here. That brings us to public comment. Is there any public that has comment for the Finance and Fiscal Resources Committee this morning? Okay, seeing none, I will close public comment, and that will bring us to the consent agenda. Is there a motion to approve the consent agenda?
Move it. Support it.
Okay, moved and supported. Is there anything that has to be pulled? Okay, seeing none, all those in favor, please say aye. Aye. Opposed, same sign. The consent agenda passes. That brings us to Circuit Court, item 3, Child Care Fund Annual Plan Approval and Appropriation. Wayman.
Yes, this is a request to the board to approve the Child Care Fund Annual Plan for 2018-2019 and appropriate $28,929,000 to the 2018-19 Child Care Fund budget. Authorize the board chair or designee to execute contract with the proposed local agencies and grant agreement with the Michigan Department of Health and Human Services and approval of grant extensions and changes within 15% of the original award, subject to final review of the documents by corporate counsel. Each year, the 17th District Court, Family Division, and the Kent County Department of Health and Human Services are required to prepare a plan showing how the child care fund dollars will be spent by each agency. The plan encompasses in-home and out-of-home placements, costs for children at risk of abuse and neglect, as well as children determined to be delinquent. The law provides that each county will receive a reimbursement from the state of 50% of the annual net expenditures for certain costs related to the placement and efforts to reduce placement. As part of the county system of care philosophy and the Dwayne B. Federal Court Settlement, the performance-based child welfare systems requirement, the child care fund includes a performance-based contract pilot that caps out-of-home child welfare costs at $4.5 million payable to Michigan Department of Health and Human Services. These funds are not subject to the 50% reimbursement. For 2019, funding will be provided to agencies on the attached contractual services providers list to provide necessary services for children in the juvenile justice and child welfare system.
Is there a motion to approve? And support? Okay, moved by Mr. Mast and supported, who did I hear? Betsy, thank you very much. So moved and supported, questions, comments, and discussion. Yes, Commissioner Mast.
What is the Dwayne B. Federal Court Settlement? Never heard about that.
Hello, Matthew.
Good morning. That was the child welfare lawsuit that Children's Rights filed several years ago now. It's gone through different iterations of defendants. First was Jennifer Granholm. Now it's been Governor Snyder, and I'm certain it will probably be the next governor too. The federal court still has jurisdiction of that in D.C. or in Detroit. Judge Edmonds, I believe, is her name.
I thought it's a closed case. I mean,
It's a settlement agreement between the state of Michigan and Children's Rights.
what does the governor say?
He's the executive that has the authority to implement the.
This was the suit that was filed by a group out of New Jersey. They went around the country, sued various states related to child care fund issues, kids being left in care and not being properly managed. They sued the state of Michigan. We had to adhere to that settlement agreement, forced us into various things that we had to do, comply with, and so this continues on, and this is what Matthew's talking about here, and it's been going on for about 8 years now.
Yeah, at least, yeah. So this has been helpful. There's a performance-based requirement in the settlement agreement for performance, and we're piloting that as part of Kent County. So, yeah, our second year.
And we're pulling about $4.5 million of the total $28 million out to do that.
We pay 100% directly to the state to do that. Yeah.
It's not subject to the 50%, right?
Commissioner Bukowski?
Thank you, Chair. We're appropriating $28.9 million. However, when you do the math in the service components, it's a fair bit shy of $28.9 million. Where does all the money go?
Well, there's a large part of the money that goes for our probation officers for the circuit court. That's eligible expenditure, so we get a 50% reimbursement. It also goes to the operation of the juvenile detention center, so we get 50% reimbursement off of that. So when you combine our probation staff, the detention center, as well as these contracts that we do for in-home care or returning children, plus the child welfare expenditures, you get to the $28 million. We can provide easily a summary of that if you'd like.
Yeah, and, thank you, that'd be awesome. And then just another note, I mean, every year I struggle with the title of this. You know, childcare, this might have been childcare in the 1950s when this was invented. However, today childcare means we're dropping our kids off at daycare, as opposed to this is about not babies at daycare, correct?
This is not babies in daycare, no. And unfortunately, this is what the state requires us to call it.
I get that. Yep.
So, But yes, it's
All right.
for child welfare services and juvenile delinquency services, juvenile justice services.
All right, thank you.
Anyone else? Okay, Matthew, I've got a quick question. When it comes to the service providers, how are those vetted for who gets the service providers in which category?
Yeah, those are always, there's a proposal processes that are conducted. We usually piggyback on other systems, whether it's Network 180's procurement or DHS's procurement. So we use our services to expand with the state dollars wherever possible to have bigger programs and get bigger bang for the buck.
And then just the details on, like, when I look at Network 180 Wrap Flex, I mean, just one example, I'm not exactly sure what that is.
You can provide a summary.
Yeah,
of
I
those
wouldn't mind a
services.
summary of these different areas that adds just a little bit more detail than just the provider and the name. Great. Anyone else? All right. Thank you. All those in favor, please say aye. Aye. Opposed, same sign. That motion passes. That brings us to item number 4, in the Health Department, revisions to Health Department fee schedule.
Yeah, this is a request to approve amendments to the Health Department's fee schedule. Public Act 368 of 1978 as amended, allows local government to fix and require payment fees for services authorized or required to be performed by the local health department. Said fees should not be more than reasonable cost of providing the service. The Health Department has attempted to create a fair and equitable fee schedule that captures the cost of services provided and is consistent with surrounding counties. As a result, the Health Department is recommending changes to 3 existing fees and the elimination of 1 fee with an effective date of November 1, 2018. All these recommendations are detailed in the attached schedule. The proposed fee changes will generate approximately $37,300 for the fiscal year 2018-19 year and have been included in the Health Department's fiscal year 2018-19 budget.
Is there a motion to approve?
Support.
Moved and supported. Questions, comments, and discussion? Yes, Commissioner Morgan.
Yeah, I have some new verbiage here. We're looking at surrounding counties when we're trying to do these costs. And I was always of the understanding that it was just based on cost allocation and the cost of providing the service. And now we're kind of going, throwing another marker or a bogey in there about what other counties are doing. And I'm just wondering, okay, so the $4,500 is not a lot of money. Is that going to come out of our general fund then? Are we going to pay that cost, or?
Let's have our health department, Teresa Grancy, step up to the plate.
Hello.
Hi.
Did you understand my question?
I understood the comment, but the question, when we have looked at fees, for other fees that we've asked for increase, we've always tried to make sure that our costs were.
It was a cost basis.
Yeah, cost basis and based on the number of increase in vaccination, increased cost of staff to provide that, are really the 2 factors, increased cost of supplies. So we do base our fees on the increased cost to deliver those vaccinations, but anytime we're looking at increasing a fee, we thought it would be important to kind of compare to what is the cost of the service in neighboring counties. In some of those cases, that cost is below still what neighboring counties provide. At other times, it's at the cost. But our basis for the increase in the fees is always primarily on what is it going to cost, how targeted the county.
So it's still cost recovery.
Absolutely.
So the information there from the other counties' fees are just that, it's information on what they charge, which,
Cost is cost.
right.
Yeah.
Yes, Commissioner Bukowski?
We've had questions in the past related to what other counties are doing. I think that's the reason that this is listed here, so that you know that we are taking a look at other surrounding counties. That's why it's listed here. But Roger's right, we look at the actual cost to deliver the service.
Commissioner Bukowski?
All right, thank you, Chair. I understand the first line and the reason why there's to reduce, actually eliminate the fee, so in case, folks just get it at no cost, so they don't have a barrier, if they can get their records all is good. However, what are the travel consult fees and who pays those? Do families pay those or do we bill those to other providers? Because then those increases seem like they would be more of a burden.
Yeah, so that cost is, for the individual versus the providers. And yes, and when we're looking again at fees, we have to look at what is the cost it's going to be to deliver that. And at the same time, as mentioned earlier, looking at other counties, it can be burdensome, but it is an area that we are steadily seeing increases in the number of travel consult fees that we're providing.
What are those?
If you don't mind, I'm going to call Christopher Bendeke, our Clinical Services Division Director, that can provide more detail on that.
Okay.
Good morning. If I can rephrase your question, I think what you're trying to get to is many of our travel vaccinations are billable to a insurance company. So currently, we bill through Blue Cross Blue Shield. So many of the clients receiving our services, we are able to bill their insurance company. But Teresa is correct. Most of them are pay out of pocket or we bill their insurance. The fee really, it's long thought that many of these individuals who have the ability to travel out of the country do have the ability to afford the additional rate, the cost of that.
Okay, so this is for people who are traveling out of the country, not for our people traveling, like, to go somewhere else to have that's what I guess
Correct.
my confusing question was,
Yeah.
what is a travel consult fee?
Thank you. The travel appointment is really, it's used majorly for, we see a lot of people traveling out of the country, whether it be for pleasure or for business. A lot of folks traveling within church groups or missionaries. So they usually come in and they meet with one of our public health nurses. They spend a good 35, 45 minutes with the nurse, going over each individual's vaccine history, the location in which they're going to be traveling, any types of events that they're going to be doing during their travel, whether it be, are they going to be eating local street carts, are they going to be eating primarily in a hotel, so all these things kind of go into a factor, and based on that, they recommend a number of vaccines for that trip.
Got it. So then my real question would then be, there would not be a thought that raising this would cause people to not get this service?
No, I don't believe so. By raising it, actually, and that's why part of the reason we provided what the other counties are offering as far as travel vaccines, consult fees, as well as what the one primary or private company in Kent County offers. Our fees are still way lower than everyone else.
All right, thank you.
Commissioner Hennessy?
I wondered what the fee increase for USCISI 693 actually is.
Sure. So very similar to a travel consult fee. Individuals coming in for, I'll tell you exactly what it is. U.S. Citizenship and Immigration Services, I-693 form. So it's individuals who are here that are seeking to become U.S. citizens. They have a form that needs to be completed that really is a list of all health forms. So they go through, the provider runs through a complete physical of that individual, and then they have to have a vaccine update provided as well. So those individuals will make an appointment with us. A public health nurse, just like with the travel consult appointment, will go through each that person's vaccine history, the country that they are relocated from, and then provide that family or that individual the necessary vaccines. And that's required for them to then take back and fill out, or have that form filled out so that they can request U.S. citizenship.
Does that answer your question, Commissioner Hennessy?
It does. Does that provide a financial hardship? And is the $10 increase
And that was, that was part of the thought behind there was to not increase it to the point where it would provide a financial hardship. Unfortunately, what we're requesting today really only covers about 28% of the cost to perform that. And as you can see, I believe what you're looking at, what I have, it's the other counties that provide the similar service are substantially higher.
Continue.
You mentioned it being individual and family. Could it cover a family application?
It's
Or
per
more than one
person.
person?
It's per person.
It is per person.
It is.
Go ahead.
I have just, are we expected to, this isn't necessarily for you, Chris, but are we expected to see other fee increases coming through from the health department? This is immunization and vaccine. Are there others we can expect to see in the coming months?
Not that I'm aware of as in regards to immunization.
We don't anticipate any fee increases.
Thank you.
Yes, Commissioner Melton?
Thank you, Chair. So if I'm trying to wrap my head around this, these fee increases are for persons that are coming to the health department seeking the expertise of whichever nurse, whatever the health provider that they see there at the health department, giving them an overview of what they need for their particular trip or mission trip or the immunizations for being a citizen. Am I correct there? Is that what the fees are for, or? So right now, if I were going on a mission trip with my family, and we came in without increasing this, we would have been paying $75 for a consult travel fee, correct?
Correct.
Okay.
That would include a family members of 2 or more. So
Family members of 2 or more.
Yeah.
And what the service provided by the county is just that, looking at my immunization record and saying my husband's, and saying, okay, you really need to have this, this, and this to go to this particular place where you are wanting to go and spend time. Is that a correct statement? Okay. Thank you.
Okay, anyone else? Thank you very much. All those in favor, please say aye. Aye. Opposed, same sign. The motion passes. That brings us to item 5 on the agenda from Spectrum Health Foundation. Wayman?
Yes, this is a request to approve the Spectrum Health Foundation contract for 2018-19, accept and appropriate $205,000 to the 2018-19 Health Fund budget for the Strong Beginnings Latina program, and authorize the board chair to execute the grant agreement and approve grant extensions and changes within 15% of the original award. For many years, Latinos in the county area have experienced disparities in birth outcomes with infant mortality rates 2 times higher than Caucasians. The Spectrum Health Foundation Strong Beginning Grant Program has been created and funded through the W.K. Kellogg Foundation to address this disparity in the IMR. The Strong Beginnings Program goals are to reduce the infant mortality rate for Latina women, to reduce the barriers to care for pregnant women, infants, and toddlers through community outreach, case management, and education, to improve care for pregnant women through improved screening and coordination, and to engage the Latino community to advocate for culturally competent care. The Health Department provides outreach support and case management services to Latino women who live in the Kent County area and are pregnant or the mother of a child of 0 to 2 years of age. The agreement period for the Spectrum Health Foundation contract is September 1, 2018 through August 31, 2019. In the event grant funding is eliminated or decreased, positions funded by this grant will be eliminated unless continuation funding is approved pursuant to the fiscal policy on grants, contracts, and donations.
So moved.
Okay, moved and supported. Questions, comments, and discussion? Yes, Commissioner Bukowski.
Thank you, Chair. Couple of quick questions, maybe. Whose money is this? In that first bullet point, it says the program was started by Kellogg, or, created and funded, but is that still current?
Yes, that is still current. This is funding for the Latina grant through the W.K. Kellogg Foundation to Spectrum Health and then contract to the health department.
Okay. So Spectrum's not adding additional dollars?
No.
Okay. And then second, this is where, I guess, sometimes the gulf between legislative committee and our committee, it'd be nice to have a couple bullet points on the impact of this money, in the sense that I've been at least a couple of community meetings where I believe that this was pointed out as a successful program. So it would be good for us to know, yeah, this is successful, and therefore we want to accept the money and continue it, as opposed to, let's say no to this money and challenge them to do something more impactful. I mean, but for this, I'm definitely supportive of it, and I know this moves forward, but it's just, should we accept the money? Sure, why not? I mean, that's very facetious on a Tuesday morning, but it would be nice to have some program flavor with especially things like this.
Yeah, and we can definitely provide a summary report of what those outcomes have been and what the impact is on.
And I know we see those in the LHR packets and minutes. However, just when it comes to items like this, just one or two, and even if it said it was reported at this meeting, so it's easier for me to find it as opposed to having to look. Does that make sense? Again, I don't want it all like 2-page memo on this, just one bullet point.
Absolutely. Yeah, we
Cool.
can definitely do that.
Cool. Thank you.
Commissioner Melton?
Thank you, Chair. So my understanding, again, so I have this right, is this both an outreach and a coming to different clinics that are set up throughout the city, and yet also an outreach to moms who perhaps don't have the means or the knowledge or the understanding that there are clinics available, and you're both?
So this is more of an outreach program. So the women who are enrolled in this program, they are matched with an outreach worker, and the outreach workers are also considered community health workers. And those community health workers are sort of peer-to-peer, and they're from the community that a lot of the women reside. And so they're providing home visits, and each of these women are also matched with a public health nurse through the maternal infant health program. So the women are getting services in the home from a nurse and paired with a community health worker, but it's all outreach. The women are not coming into clinic for services.
Okay, great, thank you.
Commissioner Hennessy?
I guess, you may be giving this explanation, but I'm curious, as was Commissioner Bolkowski, on how this operates. Does this goes through Spectrum Health for Strong Beginnings? Does it cover all of the hospitals in the community, or is it only the Latino moms who come into Spectrum hospitals?
That's a very good question. Yes, this program covers any Latino woman, a woman that is interested in being in the Strong Beginnings program. Those referrals could come from any of the hospital systems. The funding as a fiduciary just happens to be Spectrum Health as the agency who applied for the Kellogg funds. But our contract with Spectrum Health does not exclude us from enrolling women anywhere within Kent County and from any health system. Many of our referrals come through our WIC program and through our own maternal infant health program, who have identified Latino women who could benefit from this program.
Thank you.
You're welcome.
Okay, anyone else? Yes, Commissioner Mast.
So how do you interact with the program, I think it's called First Kent, or Kent First, with the other program in town that picks them up at age 1 probably or something?
Yeah, so the Strong Beginnings program, we can enroll women in the Latina grant as well as the other Strong Beginnings programs from the time that a woman conceives and becomes pregnant till their child reaches the age of 2. So the first step, First Steps Kent, or Great Start Collaborative, is more of a support type program, but a woman can receive the services through First Kent Steps as well as the Strong Beginnings program. I kind of think about it in terms of wraparound types of support services that women may need to be healthy and to make sure that their child is also ready for school. So that's kind of how the two interact, and our nurses and our community health workers are very aware of First Steps Kent, as well as many other programs and services to support the women.
They hand the family over. They hand the family over, or they basically transfer responsibility?
Well, for many of our community health workers, because there's a lot of relationship building, there are a lot of warm transfers. But the services that are provided through First Steps Kent is quite different in terms of this program being in the home. And then First Steps Kent, again, being more, making sure that they're focused on those factors that may influence whether a child is ready, school readiness type of programs and services, making sure families are connected with some of the other home-based care. But anytime our nurses or our community health workers are doing referrals, it's always a very warm referral.
Okay, anyone else? All right, thank you very much. All those in favor, please say aye. Aye. Opposed, same sign. Motion passes. That brings us to item number 6, also from the Health Department. Wayman?
Yes, this is another request to approve the Spectrum Health Hospitals contract for 2018-19 and accept and appropriate $391,900 to the Health Department's 2018 Health Fund budget for the Strong Beginnings Pay for Success program, and authorize the board chair to execute the grant agreement and approve grant extensions and changes within 15% of the original award. Strong Beginnings is a home visiting program that uses community health workers to work alongside nurses and social workers in the maternal and infant health program to provide services that do not require the skill or expertise of a nurse or a social worker. Strong Beginnings program goals are to improve birth outcomes and decrease the rate of infant mortality, to reduce the barriers to care for pregnant women, infants, and toddlers through community outreach, case management, and education, to improve care for pregnant women through improved screening and coordination, and to engage the community to advocate for culturally competent care. The Health Department provides outreach, support, and case management services to high-risk women who live in the Kent County area and are pregnant or the mother of a child 0 to 2 years of age. The agreement period for the Spectrum Health Hospitals contract is September 1, 2018 through August 31, 2019. In the event grant funding is eliminated or decreased, the positions funded by this grant will be eliminated unless continuation funding is approved pursuant to the fiscal policy on grants, contracts, and donations.
Thank you. We have a motion moved and supported. Questions, comments, and discussion on this one? Commissioner Bukowski?
Sure. Thank you, Chair. First comment, similar to the previous one, it'd be nice, a bullet point or two, the history of this. Second, does this program have a particular focus on the African-American community, or is this general population? Because I know in the past we had different contracts for infant mortality rates, because not only with the Latino community, but also in the African-American community, significantly higher than the Caucasian community.
So the Strong Beginnings Pay for Success program, that's a mouthful, is one of the priority groups is African American women because of that disparity in infant health. However, like our other programs, we do not exclude women from enrollment in those programs. Our Nurse Family Partnership Program, as a national model, is a model program that is specific to first-time African-American women. So we do have a program that is primarily focused on that population, but more on the first-time moms. So any women who doesn't qualify for that program would be enrolled in the Strong Beginnings program. But it is not exclusive, but we do place emphasis on enrolling those women so we can address that disparity.
All right, thank you.
Go ahead.
And then, real quick, thank you. The title, Pay for Success, I know a couple years ago, all the rage was social impact bonds, and I'm pretty sure this is rooted in that movement, again, that we promise savings downstream, but we'll get paid when those savings actually happen. Are we seeing success for which payment can actually be made?
Yes, this grant with the Pay for Success has been around, probably we may be going on the second or third year of that. I don't have the exact data in front of me in terms of what that success is. However, with the Pay for Success models, it's, leveraging those dollars from either it could be from local, state, or national philanthropists. Sometimes those models are based on what banks can invest in these programs. But it is, yes, the same concept with social impact bonds, an innovative approach to contracting. I know that this program, both in the Latina program and in the Strong Beginnings Pay for Success, and there's a third one through HRSA grant, all on Strong Beginnings. And what we are seeing is that the program is producing its intended outcomes. Many of the women that are in this program, we're not seeing NICU visits. We're seeing women deliver to full term. We're seeing women that are delivering less low birth weight or preterm births. And those are many of the factors that put people at risk for an adverse pregnancy outcome. So I would say yes, but we can definitely get what that return is for you.
All right, thank you.
You're welcome.
Okay. Commissioner Mast?
Sort of the same question as Mr. Bukowski. With the exception of the beginning paragraph, all the other 4 paragraphs in each of these 2 requests are exactly the same. So some of the money is coming from Spectrum Health hospitals, some is coming from their foundation through W.K. Kellogg. And the one is specifically for Latinos, the other is for more broad-based. And you just said for African-American department.
Yeah, so the one for the foundation, again, that is specific with Kellogg funds. And then with the Spectrum Health hospitals, there's probably different funds that Spectrum Health hospitals taps into from maybe a few different sources of funding to leverage those dollars so they can scale up this program to be able to reach more women. I can get a breakdown of what those funding sources are from Spectrum Health hospitals. As mentioned, there is a third grant that is funded through the Health Resources Service Administration for Strong Beginnings, but the Pay for Success is a combination of funds through Spectrum Health hospitals and other funding sources. I just need to be able to contact Spectrum and find out what those other funding sources are that they're leveraging.
But it must be some of the same staff that you have, that the health department has.
Yeah, so there's,
Money from both, two different sources.
absolutely. So there we have 2, I believe, FTE outreach workers that are designated for the Strong Beginnings that are paid for out of the Kellogg Foundation, and then the other community health workers are funded by Spectrum Health hospitals and other sources.
And our finance department must keep those straight.
Absolutely.
Absolutely.
So we don't overspend our 77,000 that we commit, or 23,000 that we commit.
We do not overspend.
We do a good job in tracking those expenses.
Thank you.
Commissioner Hennessy?
I was going to explore, it's been mentioned a few times, how you define high-risk women.
Yes.
Is it strictly financial, or you mentioned some of the other risk factors in terms of, having babies with, low birth weights or that type of thing. How do you define them, and how do you find them specifically?
Yeah, and I do want to mention again, because sometimes we utilize that language, high risk, and that could vary from one woman to another depending on their needs. We do enroll women that may not be high risk, but some of the things that our nurses and our community health workers and our community partners look for are looking at those previous pregnancy outcomes, which could be, did a woman have a stillbirth or miscarriage? Did a woman previous pregnancy end in an infant lost? Women who had a preterm birth, women who had a very low birth weight or a low birth weight infant, a woman who maybe delivered at maybe anywhere between 34 to 36 weeks. Those are some of the things that we consider in the programs that are evidence-based also consider to be high risk. Are those women who either had a difficult pregnancy or those pregnancies resulted in one of those adverse pregnancy outcomes. But there's a number of other factors, women who may not have a support system in place, women who may not know how to navigate some of the many services that we have available that just maybe need someone to walk beside them.
Okay, anyone else? Thank you very much. Seeing none, all those in favor, please say aye. Aye. Opposed, same sign. Motion passes. That brings us to item number 7 from the prosecutor's office. Wayman?
Yes, this is a request to the board to appropriate $1.2 million to the 2018-19 Title IV-E grant budget in the Special Projects Fund and authorize the board chair or designate to approve grant extensions and changes within 15% of the original award. The Michigan Department of Health and Human Services provides supplemental funding to counties to operate a cooperative reimbursement program to enhance child protection and permanence. Beginning in 2017, the state moved to a 5-year grant cycle to reduce the workload and processing requirements for the state and the county. The Board of Commissioners approved the 5-year Title IV-E grant agreement with the Michigan Department of Health Services via Board Resolution 981663. Title IV-E grant agreement calls for the state to allocate $140,000 per year. The level of county general fund support is reviewed and adjusted annually. The recommended general fund support for the 3-year grant agreement is $1.1 million.
Okay, is there a motion to approve? Is there support? Questions, comments, and discussion? All right, seeing none, all those in favor, please say aye. Aye. Opposed, same sign. That motion passes. That brings us to miscellaneous. Is there any commissioner miscellaneous this morning? Commissioner Hennessy?
We approved the consent agenda without a lot of discussion, but I just was going to draw some attention to it in terms of the fact that, just as we have this health department, the grants that we were accepting there that really work with, women and are very proactive in keeping the health and welfare of our community. I think some of the other actions we take which go towards our state budgets, towards our own budget when it comes to 2019, were affected by the consent agenda, like the supervising visitation and enhancing visitation at the front of the court, providing milk and meals and accepting a grant to serve the children in our juvenile detention center, and and even to look at the hazardous materials and the emergency preparedness for that. So there are other things that we're doing that are really proactive in terms of helping the health and welfare of this community.
Thank you. Is there anyone else who has any miscellaneous this morning? All right, seeing none, we will adjourn. Our next meeting date is Tuesday, September 18th.
I am Kent County. I am Kent County.
I am Kent County.
We are 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 Kent County.
Beya, Kent County. Ami, Kent County.
Somos Kent County.
Mas Ira, Kent County.
We are Kent County. We are Kent County. We are Kent County. Oh yeah.